Welcome to Logical Ayurveda. Today we are going to discuss in detail about treatment of Vataja Grahani. So, I am making you remember the symptoms of Vataja Grahani once more because it has been long since the video has been released. So, Vataja Grahani, the symptoms of Vataja Grahani is repeated watery stools and equal bouts of constipation and alternate, associated with the pain in lower abdomen and flanks, and associated with the extreme dhatukshaya for the patient, weight loss, etc. The vata is so much so that the patient will have tinnitus, ringing sound in the ears, and because the patient is having this Vataja Grahani, so it is very difficult for the patient of Vataja Grahani. Their mental status will be horrible. See, a aged patient with a Vataja Grahani cannot go anywhere in bus, cannot go anywhere in car. They have to only choose train because they will get episode of dysentery once in every half an hour or 2 hours. So they have to choose a train for wherever they are going because they cannot get in the car, because once they get in the car they have to stop once in a while. So train is better for them. And everywhere they go, they have to, if they had to go to a temple or if they had to go to a special place, they have to wear their adult diapers, and they suffer from so much mental agony, so much. Just imagine if anyone has the same condition, how their mental status would be. So such will be the condition of Vataja Grahani when they have repeated bouts of dysentery continuously every 2 hours and then constipation for 2 days. It will be very, very much horrible. So we as a doctor should have extreme empathy and sympathy for those patients. So coming to how we treat the Vataja Grahani, before treating Vataja Grahani, we need to identify whether the particular Vataja Grahani, the chronic Grahani patient comes, we see all the symptoms and we identify it as Vataja Grahani. We have to find out whether the patient, the Vataja Grahani is associated with the ama or it is not associated with the ama or ajirna. How would you find the patient of Vataja Grahani? The same symptoms, the same Vataja Grahani symptoms when it is associated with the ama, patient will have lakshanas of ama. Like what are ama lakshanas? As mentioned in Ashtanga Hridaya, Shrotarodha Balabramsha, Gauravanila Mudataha, Aruchi Apakti Nishtiva, Klama, everything will be there. The tongue will be coated. They will feel severely heavy after the intake of food. They don't have proper digestion. Their stomach will be bloated regularly. And all those other symptoms of ama will be present. If the patient Vataja Grahani has ama, the treatment is different, and they are nirama, the treatment is different. If they have ama, the first thing is we need to correct that ama. Go back to Kafaja Grahani Chikitsa, that is the proper treating of Kafaja or Amaja Grahani. Such protocol has to be followed before treating the Vata. First ama has to be cleared, like Kaidaryadi Kashayam and Vilvadi Guliga, Madhifala Rasayanam, Induganta Kashayam, Pachanamrita Kashayam, etc. All those Jirna Dravyas has to be given, and the patient should be, because without having proper digestion, even medicines won't digest properly. No matter if you directly give Dadimadi Grita to the patient with ama, definitely Grita will increase again the symptom of Grahani, and Grita will go in dysentery only. So it is very important that we should identify whether the patient has ama lakshanas or not, and then proceed with the treatment. If they have ama lakshanas, treat the same as Kafaja Grahani. Give them Pachana and Deepana Aushadhis and make their digestion better, and then come back to treating the Vata. So and if it is a Nirama Grahani, so ama is not greatly associated for the patient, how do we treat Nirama Grahani? See, Grahani, treating Vata in every disease is like playing kabaddi. You go one side, the disease will go other side. You go other side, the disease will go this side. So, for example, if you are treating a patient with a severe Vataja Grahani, say if the person has lot of bleeding, you give Mahatikta Grita. Then the patient will have lot of ajirna and ama. If the patient has lot of ajirna and ama, you give Kaidaryadi Kashayam or Vilvadi Guliga, Shaddaranam, etc. The patient have more bleeding. So while treating this condition, we have to be extremely sensitive and situation biased rather than choosing a single drug per se for all the conditions. We have to be extremely sensible about the climate, about the kind of food they are using, and the kind of climate, and the kind of Rutucharya that they are in, and the kind of desha that they are in, and the seasonal changes happen within the intestine, whether they are bleeding, whether they have ama, whether they have nirama. All these conditions should be particularly taken care of. See, treating a simple Kafaja Grahani or Pittaja Grahani anyone can do. Treating a complex Vataja Grahani is what makes you a great Ayurvedic doctor. treating Sannipataja Jwara that days, in those whole days, was the benchmark of completing the internship and the course. And just like that, today, if you are an excellent doctor, you should be able to successfully treat or at least maintain Vataja Grahani for what it is. So you have to be very sensible about the varying conditions that happen from time to time, and you have to be very encouraging to the patient. You need to be very patient with the patient, listen to their symptoms, reassure them 1,000 times, because it's a horrible condition for anyone to have. And you also have to keep in part that the patient is extremely stressful, and it will not hurt a little when you listen to the symptoms more and reassure them a little.